Thank you very much, Dr. Senator. Now I would like to call on Dr. Michael Krausz to come to the podium. Dr. Krausz was recruited from Hamburg, Germany, because of his world-renowned leadership in addiction and mental illness. He is currently forming a Center for Concurrent Disorders of Mental Illness and Drug Addiction at University of British Columbia. He's the principal investigator for the upcoming Salome Research Project, principal investigator on a $22 million federally funded mental illness and homelessness project. He is instituting research that has the potential to revolutionize treatment for chronic addiction. He works closely with the Interchange Society as a research advisor. Please welcome Dr. Michael Krausz.
So, I will try to follow my role model here, Max. That was the shortest presentation I ever heard from him. Starting, I think it can't be a surprise to anyone that the situation in, for instance, the downtown east side of Vancouver or around mental health and addiction didn't really change over the last decades. If you look at what the amount of burden of disease is that we have to suffer due to the WHO stats, that 25% of all burden of disease is due to mental health and addiction, and only 5% of the resources are actually going to research and clinical services in this area. But I want to share especially one take-home message with you and one core experience as a therapist, as an addiction therapist and a clinical researcher. The key component to recover from addiction or mental illness is not the number of symptoms you are suffering. It's not the amount of diagnosis we can document. It's really the amount of resources you have. It's very important to look at the strengths. And recovery is related to the resources, and that's also, from my experience, that's also true for cities. That's also true for social communities. And so I think the critically committed people here in the room, and like people from the Interchange Society or Sam Sullivan or other really political leaders, are an important resource to address those issues, and they need to partner with clinical and research experts to make things happen and to find the right solutions. If you visit the famous Swiss city, Zurich, now, you wouldn't recognize how it looks like in their needle park in the beginning of the 90s. So they were able to organize and to really provide a major shift and a major change in their city. And there is no open drug scene there anymore, and there is really a sufficient treatment program and a major change in the city. So what I would recommend as resources are three things, and this is my take-home message. One, I think, beside all the good solutions that are available or can be developed in the next little while, I think we need a better governance based on evidence. And that's what I try to support through a Center of Excellence for Addiction and Concurrent Disorders. Second, we need innovation for all those areas difficult to tackle where we don't have best practice through research. And the Salome trial just mentioned is one contribution to that. And Naomi was already quite successful. And third, we need capacity to provide access to treatment. And we need to show that treatment for addiction is as successful as the treatment for any other chronic conditions. The take-home message is really let's join forces in end resignation and helplessness and make Vancouver a laboratory of solution instead of perpetuating vicious circles. Thank you very much for your interest.